Good afternoon. Were you aware of the scleroderma disorder before participating in this awareness activity?
I was a little aware. I was given the opportunity to participate in a workshop that was held in the Albany Pharmacy College, but before that workshop, I didn't know anything about scleroderma.
I've only heard about it once before because I had a previous workshop, but before that I'd never even heard about it, and then, which is kind of sad being in the health field, we want to know more about it to be able to do more moving forward. So I'm glad we're talking about it now.
No, but I've heard of it before, but I really didn't know very much about it until this event, and then after reading some of the articles and watching the video that we had to watch for this event. But other than that, I really didn't have much background information about scleroderma at all.
So I was definitely aware of the condition and everything. I really didn't know much about it. Honestly, we got sent like a background video, which basically gave me a lot of the knowledge. We just touched about it in pharmacy school during one of our semesters, but not really into much depth at all.
I honestly was not aware of the scleroderma disease at all before this, so I'm really glad to be a part of this because this is very educational for me.
I actually was not. This is a big educational experience for me.
Were there particular aspects of the films that you watched before the scleroderma awareness event that made an impression on you?
I think how quickly it can transpire, how it starts off as hardening of the skin, but then really affects the organs and other functions in the hands and legs. So I guess how quickly it can manifest.
I think one of the biggest areas that have made an impression on me is just how much this can impact a person's daily life. The different symptoms that come with it, such as the fatigue and the tightening of the skin and the muscles, can make it so hard to do your everyday tasks, and that's what makes our life meaningful. So as the more and more trouble that is, the harder it is to do the things we love to do every day.
I definitely think the entire video was very educational, especially touching upon the nutrition aspect, because it showed how big of a role that dietitians and nutritionists have regarding patients with this condition, since they do have a lot of GI symptoms that really can contribute to malnutrition. And having, these patients see a dietitian regularly can really help them, increase their quality of life and increase, their nutrition status as well. So I think it's overall, the video itself was very educational and definitely gave me some tips on what kind of interventions I would do, since I am in my clinical rotation. So I do see patients constantly. I haven't seen anyone with this condition, but if I ever do, I would know what to recommend and how to deal with their different, GI symptoms and issues as well.
Yeah, I definitely think one of the biggest things was that every patient kind of has a really different outlook with how the disease is going to affect them. Some people it can be more of like a sort of topical condition, and while others it can really diffuse into a lot of the different organs and cause a lot of different mortality risks and everything. I think it's just kind of dealing with different patients that really, even though you have a same patient with maybe the same condition, there's going to be a lot of variation probably in a lot of the treatment options and a lot of the outlooks. And so it's kind of just dealing with it on a patient-to-patient basis.
Just the impact that it has. I'm an OT student, and it has such an impact on everyday life, every part of functioning. So as a client-centered practice, I think that those movies really opened up my eyes to see that it's such a holistic disease and it can affect every part of someone's life.
Yes. For example, I could kind of fathom just from reading some of the articles about how scleroderma could affect the esophagus and some of the gastrointestinal tract, but I didn't quite understand how it could affect malabsorption and some of the nutrient deficiencies until I really watched the videos.
What do you see as the value of interprofessional education when you move into the workforce?
I think it's so important. We should be working with people from different disciplines in order to better help the clients that we serve. Each client is going to have a presentation, a unique presentation, and it's important that we're able to work with others in order to help that client.
I think interprofessional committees and programs like this are so important because there are so many different people with so much different education, and all of us together can make much bigger impact than one person. And having all of us together about one case with so many different outlooks, such as the physical situation a person's going through, the cognitive situation, the mental health situation, we can do a lot more for somebody if we're all sharing all of our ideas. And I definitely think it's something that we should keep doing going forward.
The importance of interdisciplinary, like an interdisciplinary team. Yeah, I definitely think because in a hospital or in any kind of healthcare facility, there's different professional professions and specialties, and I think because this condition involves so many different aspects that it's important for teamwork and communication in order to provide the best care for the patient. So constantly communicating and, talking about the different interventions. Since I believe different aspects of the hospital, it kind of flows, so communication is really important to providing the best care for the patient.
I think as a healthcare team, we all have to move together to kind of just work more as a team. Our healthcare system kind of spends a lot of money and doesn't really have the greatest outcomes so far compared to a lot of the other countries. And I think one thing is just working together, even from everywhere from, like we have today, we have occupational therapists here, pharmacy here, doctors aren't here, but there's a lot of different fields, and it's good to see input. I've never really got to work much with occupational therapists other than at these IPE meetings, so it's kind of good to just see a different opinion, different field and everything, and see how they can look at things and how they can also help us and how we can help them just kind of working through disease states like this that are so difficult to handle.
I think it's so important because, like I said, it's so important to be client-centered and holistic, and the right hand needs to know what the left hand is doing. So if we communicate and we talk about a patient, we all have different perspectives and different backgrounds that we come from. So it's so important to talk to each other so that we can provide the most holistic experience for the patient.
I think it's huge. I mean, every member has a place within the team. In order to just go through daily activities, you need to have PT there to help develop strength. You need to have OT there in order to help remember how to eat, and then you need to have a dietitian there in order to make it so they can eat. Each member has, and that's not the entire team, but that's just to show a little example. But each member plays a role in getting people to where they need to be and getting people to stand on their own 2 feet, or whatever that means for that person, however that means that person can progress and to be able to go on and to be able to survive and to flourish and to live their lives from a day-to-day perspective.
What were the most significant things that you learned by participating in this scleroderma awareness event?
I think the most significant things was learning how to adapt to the patient's needs. Our patient that sat at our table actually just was diagnosed with scleroderma today at 2:30. So all of our questions kind of went out the window, and we really had to just go with like what she really needed at that moment, and that was the most significant. And then I think also learning how to adapt our questions and change them so that they really went with all of our different disciplines, so that they pertain to everything that we wanted to talk about, was also probably very significant and helpful.
The most significant thing that I learned during this event is the importance of a multidisciplinary team with a multimodal approach and the communication between all the different disciplines. Really sitting in a group with, OT, pharmacy, nutrition, which is myself, nursing, psych, it just really brings so much to the table, more than just me going in as if from a nutrition perspective, because listening to OT, ask about activities of daily living, how they can perform their, normal tasks, really also impact nutrition, because, their daily living includes cooking, shopping, and that impacts from the nutrition perspective. So I thought it was really eye-opening, and being able to talk to the patient, and it's so much more than, reading about the different symptoms off an article. Really engaging with them and talking to them was really, really just a wonderful experience, and I'm really happy I got to experience that.
Definitely the most significant thing that I learned so far was just really to get familiar with your patient. You got to at first make that patient interaction. Without really developing that interaction completely, the patient's not going to be able to open up to whatever healthcare provider it is, and you really aren't going to dig into the details of what really separates their condition from other scleroderma patients as well. And you kind of get to understand what's most important for them and what really you can do to help focus on that importance and move forward from there to make sure that you're treating them as an individual case. I know before I was touching upon a little bit that each case is different, but sort of today, after seeing a lot of the patients around the table, you really can see that some patients have it's definitely visible that they have the condition, and then the others you won't even really know. So kind of like each patient, just wanting to make sure that you really get their full story and how they want to move forward, and then what the best way you can help them is.
I think one of the most significant things that I learned was how important it is to individualize care between each person, especially with one of the stories, how she talked about how difficult it was for her to open medicine bottles. Like, I would never have thought of that, and just to be mindful of that when working with each client or each patient.
I think one of the best parts was being able to actually talk with a patient who's experiencing it, because I feel like you learn so much more talking from someone and hearing their life story and the everyday struggles than you would ever learn in a textbook. And I think what was nice about this event was having people from different professions at the table, because you really start to see how one body function can impact everything else and how we all need to be in the picture. Like, one of the things I learned was that, like, I never even knew about the difficulties with, like, the digestive system relating to scleroderma. And if somebody's not getting the nutrients that they need because they can't swallow or have trouble in one way or another, and that may be a dietetics area, but it'll affect their occupational functioning, which is our area, because if they're fatigued because they haven't gotten the nutrients or not feeling well or tired, it'll impact their other areas of life. So having us all be able to talk about things together really helped, I think, and see the big picture, the person, their whole life, not just little snippets. So it was really informative.
So I think the most important thing I learned was how important it is to have all of those different disciplines working together, because all of us have different ideas. We come from different perspectives, and just like our patients, we're multifaceted, and we need to bring all of our ideas together to help all of these multifaceted areas that these patients need help with. And I also took away just the importance of listening to the patient and listening to what their concerns are, rather than just spewing off our ideas from our profession. It's so important to really take into consideration what matters to them.
Did any light bulbs turn on an interest or ideas or learning that you would like to pursue anything about scleroderma?
Yeah, I mean, for sure. The light bulbs actually turned on the moment that I started reading the research about scleroderma, because I had no idea about all the involvement of the gastrointestinal tract, and the role of a dietitian is huge in that. So immediately I started thinking, oh, this is something I could be very interested in. And then just talking to the patient today, and all of her questions were diet related. So I could definitely see myself pursuing something related to either research or counseling patients who had scleroderma, for sure.
So I definitely, after today, I am gonna, do more research maybe in terms of, because I've never dealt with a scleroderma patient in my practicum, but since I've learned so much, I want to know so much more and how we can help them from a nutrition perspective, malnutrition, and since both the patients that talked today, including my own at the table, they all had swallowing issues. So that's something I want to look into, how we can help them with that, different diets, how you can modify the food, just so they could improve their nutrition status, which will improve their quality of life, since food is such an important part of everyone's daily living. And with the restrictions that, for example, Amy had, how to, modify their diet in their normal lives to include the food she likes, but also be able for her to tolerate and not aggravate any symptoms. So just, a balancing act, definitely, yeah.
I think definitely just going forward with, from a pharmacy standpoint, the treatment. I'm really not familiar with a lot of the treatment options that are available or emerging therapies. A lot of the medications that the patients did talk about were ones that we do see every day in the pharmacy, but just kind of how they're dosed towards a scleroderma patient and how the doses do change, how the regimen changes. I noticed that there was a kind of interesting antidepressant dosing in one of the patients, and it was much different than anything that I've seen before in just your typical patient that has some form of depression or mood or anxiety. So it was just a lot of things something to look into so that I could help benefit my patients the better moving forward.
I think just in general, being mindful of other professions, going into this, I had a very broad understanding of what each person did, but just being aware of maybe if you have somebody with scleroderma that comes in, like especially in a psychology setting where I'm in, being able to refer them to different areas if they have different concerns, and being mindful of, where could I lead this person so they could help address this issue where I may not be as familiar with.
One thing I never knew before, and our patient mentioned, was that she has a lot of pain in her eyes, and I'm not really sure exactly what's stems from that, but she said that she's heard a lot of patients have like weakness, and I would be interested in learning more about how occupational therapy can help in this area, such as maybe recommending sunglasses for certain environments that are brighter if the muscles in the eyes, because our eyes have muscles too, and they can get tight and they can get fatigued, and just how else can we influence our day to help these patients relieve some of that pain in their eyes, because if your eyes hurt, it can make it so difficult to do all the daily functions that are important to you. And you just want to shut your eyes and take a nap because your eyes hurt to open, and you're not doing the things you love to do if you're doing that. So I'd be interested to learn more in that area, like what we can do to help.
I really enjoyed, we talked with our patient a lot about things that she changed in her environment to help her. And we actually talked about, she had trouble with the round handles on doors. And I talked about how in OT we have these devices that help to open doors like that. And so it was just really awesome to give her that idea, and it made a light bulb in her head, and it just made me happy to see that OT can really help someone like her.
So my name is Amelia. I'm a dietetic intern here at Sage. What was the other thing?
And what is your level?
Oh, my level? Yes, so I didn't finish my undergrad at NYU, and then I'm doing my first year, or my 10-month internship here at Sage. I'm completing all my rotations at the Albany Stratton VA Medical Center.
So my name's James Mango. I'm a pharmacy student. Right now I'm a 6th-year student, so I graduate in May, and I'm from locally around the area.
I'm Leah. I am a 2nd-year OT student, and I hope to change the world with OT.
Thank you very much.
Thank you.
My name is Nadia, and I'm a 2nd-year graduate student in the Counseling and Community Psychology program.
My name is Maggie Sanderson. I'm an occupational therapy student in the graduate program. What was that?
My name is Selena LaVista. I am a dietetic intern. I'm a graduate student, and so I'm in nutrition.